to make the kidney move down, so you can do the puncture in the labs. Yeah, here is one. When I was studying in the Wikipedia University, just for the huge the gentlemen in the urology, they have bigger heads, are also more stable. They can stay together. Maybe you can do that with this. Yeah. After there is puncture, there is the sample of kidney biopsy samples. And here is the picture. You see, this one is like the CT scan. Yeah, CT scan is like this. You can see the needle here in the lower power. This one is ultra scan. Can you see the kidney? Here is the capsule here. Yeah, this is maybe medulla. This is a cortex. There's a needle just in the lower part of it. So you have to try to identify it. Now, after that, you have to make sure the sample, to make sure it can be sent to the IF, AM, at the end. So there's most popular section of the sample to have to make sure. The cortex is more red one is the glomerulus. Yeah, this one maybe this is medulla. So if you're in our center, we have the biopsy, the pathology in our center. So the sample will send there very soon, so the pathologist will do the sample prepare. But if in your center, I didn't try the most other centers like in the community or some country, they have to send it to the maybe sent to Beijing or Shanghai or Guangzhou. So you have to do this separation by themselves. I don't know how happened in your countries, because when I was studying in the USA, there are maybe 5 very famous pathology center. So in the Wikipedia, you will see that they will receive about 5 centers from the central or south part of the USA. Also, sometimes we will receive international samples from Canada or Australia. So this sample will be just transported by maybe by airplane or some things. It will be separated by themselves. So you have to know have some idea about this, how to do separation. So the complications, the most, maybe sometimes in pain, mature, the most severe is hemorrhage. Yeah, the hemorrhage couldn't stop, it may be into life-threatening bleeding. About 20% of the puncture will have an arterial venous fistula in the kidney, but most of them will be because the higher pressure in the artery it will be compressed, or sometimes so it's not severe. Sometimes one case in our center, the arterial venous fistula persists for one month. So we have to do the intervention to just do some throttling just between them to make it closed. Yeah. Here you can see, can you identify there's some adenoma here? This ultrasound picture is the kidney. This might be the hematoma. Yeah, here is this one is also another hematoma. So for small hematoma or hemature, that is really common after renal biopsy because there is some puncture there. But if there is very large, more than 4 centimeters, or that is maybe called middle-sized, we have to be careful to check about the change of hemoglobin level, or whether it is the blood pressure patient. Yeah. So this is a common test on the pathology stand or to check out, like the night microscopy. You know, the most common one is HE for the tissue samples, but in renal samples we have to do also pass, use, and tricom. HE we can identify the nuclei and every cells, so we can tell different types of cells. But the pass can highlight the protein or some glycogen protein, so we have to identify the messenger or some matrix. Jones has highlighted the GBM or some fibrous tissues, so we can to identify the GBM and some fibrosis areas. Trichome is more common for to identify the fibrosis. Yeah. So for immunofluorescence, we have to immunoglobulin, also complement, this recipient here for the plastic pathway, and also do not forget kappa lambda. Kappa lambda, there is some imbalance. Yes, just to the sterilization. This Professor Yang, yes, this is the video has some little kid to do the local anesthesia. This is the biopsy we call it gut culture. Yeah, that is the real-time ultrasound here. There is the distance anything you can say it. Yeah. To check out the longitudinal or correct section. Now we have to do the punch, but quite quick. Maybe the whole procedure maybe 2 or 3 centimeters, minutes, 2 or 3. If patients do the breast preparation very very good, yes. So it's just an introduction of the renal biopsy.